This is Shebli Atrash from the Levine Cancer Institute in Charlotte. I will be talking about the final results of Phase 1 Belantamab Mafodotin in combination with Carfilzomib, Lenalidomide, and Dexamethasone for patients after at least one line prior treatment for multiple myeloma. We enrolled in this trial about 19 patients. We did it in dose escalation fashion, followed by dose expansion. Patients with at least one prior line of treatment were enrolled. Most of our patients received 1 to 3 prior lines. Baseline characteristics were very diverse for our population, representing our population in Charlotte. We had about 30% African American patients enrolled in the trial. So with the first dose of 1.4 milligrams per kilogram given every 2 cycles, that will be every 8 weeks. We encountered one dose-limiting toxicity of thrombocytopenia. Suffice to say that this patient continued to be on the trial and had a very deep response, MRD negative 10 to minus 6. With the second dose, after 6 patients enrolled, we cleared that dose and we moved on to the second dose, which is 1.9 milligrams per kilogram, and we did not see any dose-limiting toxicity at that dose. Also, we included an expansion phase. We enrolled extra 6 patients to confirm the efficacy and the safety of the selected dose, and we did not encounter any dose-limiting toxicities for that. Regarding the overall toxicities, were mainly hematological. No signal of increased infections. However, it's important to note that keratopathy was present in about 95% of the patients, as expected from Belantamab Mafodotin. It was reversible. Grades were better than every 3 weeks dosing. And we included in the trial dose hold if a patient has grade 2 or higher keratopathy to allow for full recovery prior to starting Belantamab Mafodotin. So 100% of the patients received the first dose of Belantamab Mafodotin. For subsequent doses, it ranged between 30% and 70% of the patients got their doses, with an average above 50% of the patients were able to get their subsequent doses successfully. In terms of the efficacy of the treatment, we have seen 100% response rates. More than half the patients were in stringent complete response with MRD negative disease to the level 10 to minus 6 as measured by flow cytometry. Those results are very encouraging. We already opened our phase 2 portion of this trial. Our phase 2 will be focusing on newly diagnosed multiple myeloma patients with high-risk disease. We believe that we could do better in this subgroup of patients in order to improve progression-free survival and overall survival. And the phase 2 portion of the trial is going to be multiple centers involved. We will include 4 cycles of Belantamab KRD, and then allow for stem cell collection, then another 4 cycles before we proceed for stem cell transplant, if the patient is transplant eligible, and then we'll followed by KR and Belantamab Mafodotin maintenance for up to about 20 cycles before we move on to physician's choice of maintenance, whether with Lenalidomide or with Carfilzomib and Lenalidomide combination. Most of the recommendations will come out based on the MRD negativity rates at the end of the triplet maintenance approach.